Good morning, I'm Sunetra Choudhury, political editor of the Hindustan Times, bringing you all that you need to know about COVID-19 on Monday, the 27th of July. Our top story today is all about the numbers. In just the last 24 hours, for the first time, we've had more than 50,000 new cases in just the last 24 hours. 50,517 to be precise. The total number of deaths stands at 32,811. But with these 50,000 new cases in just the last 24 hours, the total number of infections in the country goes to 1.4 million or 14 lakh cases. The highest number of them comes from Maharashtra. It continues to be from Maharashtra with almost 10,000, 9,400 cases in the last 24 hours, followed by Andhra Pradesh and Tamil Nadu. Now, the major cause of concern in all of these spikes in numbers is the fact that in several places across the country, which are now seen as the new hotspots, the doubling rate has been dipping. Now, remember, doubling rate is the amount of time that it takes for the total number of cases to double in number. And across the country, the trend has been, and what policymakers and government has been pointing out, that in most places and India's average doubling rate has been slowing down. But in all of these places that we are going to tell you about, which is Andhra Pradesh, Bihar, Bengal, and Karnataka, the doubling rate has really fallen over the last month. Take, for instance, Bihar. Now, a month ago, the doubling rate used to be 27. Now, that has dipped to 14. Or if you go look at Bengal, it used to be 22 days for the number of cases to double. That has now dipped to just 8. And most worrying, the doubling rate in Karnataka has dipped from 17.5 days to 5.5 days. That's how troubling these numbers are. And these may be emerging as the new hotspots, which is why you've had the cabinet secretary meeting with these states last week. Well, amidst these gloomy figures, is there any good news? Well, there is good news from Delhi, and it shows that if attention is paid, if the policymakers and health workers really pay attention, and citizens as well, of course, then you can really turn around the situation. So Hindustan Times' report shows that between June and July, the death rate in Delhi has really dropped, in fact, up to 44%. It shows that between 1st June and 12th of June and the consecutive period in July, in June, the deaths was over 1,000. In July, that number is now just over 600. And it also says that the deaths which were happening within 24 hours was 34% in June. That's now dropped to 15%. So it just shows how things have really improved here in the capital. Well, there's another figure and a story in the Hindustan Times, and this one is about whether newborns contract infections from their mothers. Well, what's interesting is that doctors are saying that while there are 18 newborns since March who have contracted the coronavirus soon after they were born, within a few hours or within 5 days, and that's in Delhi. However, they say it's not from the mother. Transmission, they say vertical transmission cannot take place. It shows that newborns can quickly get coronavirus if people aren't careful. They also recommend that mothers, even if they are COVID positive, should breastfeed their children. And that's something that a study in New York has also shown, that breastfeeding is very, very important, and there's no danger of children, babies, contracting the coronavirus via breastfeeding. And finally, North Korea is now reporting that it may have its first corona infection, while experts outside have questioned the fact they haven't had a single case. They're saying that they have got one person who had gone off to South Korea and has come back in the last week, may be showing symptoms, and that's why have done a lockdown in the border city of Kaesong. So that's one situation they're watching out for. Those are the news updates for now. Keep tracking them on HindustanTimes.com.